I am June Noto with the JAMA. I'm the Vice President of Information Technology, Human Resources, and Administrative Services. And we welcome our technology partner today, Chest Health, and they are presenting on how to discover the power of digital solutions and peer support in substance use treatment, which can increase patient retention and improve clinical outcomes. I'd like to introduce from Chest Health, Catherine Connell, who's a dedicated professional with 13 years experience in the behavioral health field. She's the regional director over at Chest Health, and her mission is to provide innovative tools and solutions to combat substance use disorder crisis. After working as a provider for years, her passion for helping those in need drove her to explore new adventures and technologies that can make a real difference in people's lives. With a creative and forward-thinking approach, Catherine aims to revolutionize the way we address and support individuals struggling with substance use disorder. So welcome, Catherine. She's going to introduce our two guest speakers today, who are both providers that are using the Chest Health application.
Thanks, June. I appreciate it. It's always awkward to hear your own bio read to you. I'm going to share my screen before I forget and make sure that everyone can see that. Can you see my screen? Just a nod would be great. Okay, perfect. I was struggling with it earlier. So yeah, thank you all for joining the call today, and happy Halloween to anyone that may celebrate. Bonus points if anyone shows their costume on the call today. But we are excited to share some information about Chest Health with all of you, and really discuss how our solution can benefit your patients, your outcomes, and importantly, your staff. And I do want to jump in fairly quickly, but we are very privileged to have a couple of our partners on the call today, and so to share their experience. So I'll start with some brief introductions. My name is Catherine Connell. You just heard all about me a second ago. But we do have two providers on the call that we work with, Alex Figueroa from United Counseling Services of Bennington County and Jill Gamez from Arbor Place. So we'll go into some more detail with them in a bit, but Alex and Jill, would you like to kind of quickly introduce yourselves?
Sure. Lisa got her twist on it, and then it became a prevention event and focused on that.
Yep, just be back. Thank you. So my name is Alex Figueroa, Associate Director for Substance Use Disorder Services in Bennington County. We're actually located in southern Vermont. Yeah, I woke up this morning and it was already 31 degrees, so the cold is coming. But a little bit about UCS. We are a designated mental health and substance use agency. We're one of 12 DAs throughout the state of Vermont, which basically means, you know, we're licensed to provide mental health and substance use services. But to come time to my portion of the presentation, I'll share a little bit more.
Thanks, Alex.
All right, hi everyone. Yep, my name is Jill Gamez, and I am in the great state of Wisconsin. And although I did not dress up for Halloween, we definitely got tricked around here this morning already because I woke up to snow. Yes. Hopefully it will be melted by the end of this week. But anyway, I have been at Arbor Place, a mental health and substance use disorder treatment clinic, for over 20 years. And we offer outpatient as well as residential services. And I will share more about our organization and how we've used the Chest Health product when a little bit later in the presentation.
Awesome. Thank you both. And thank you again for joining the call today. So first things first, please feel free to unmute yourselves and ask questions, or you can use the chat feature. We certainly encourage questions and comments, so feel free to share. And for today's call, I want to briefly go over kind of our understanding of the patient journey as well as your business needs as a provider organization. We will then kind of quickly introduce Chest Health as a company and explain some of the functionality of the e-recovery solution. And then after explaining what that solution offers, we will get to hear from our two partners on the call today about how they're using e-recovery in their respective organizations and the impact it's had on their patient, staff, and business as a whole. So we'll certainly end with a discussion period, but again, feel free to shout out any questions you have along the way. I unfortunately, when I share my screen, cannot see you all, so just interrupt me. So we offer solutions to support the entire addiction management cycle, and this graphic depicts what a patient journey may look like. So prior to the onset or during the onset of SUD, we offer ePrevention, which is a configurable assessment tool that expands access to screenings and offers smart interventions. Once a trigger moment occurs and connection to care is necessary, we offer e-intervention, which is a closed loop referral management system. And these two solutions can work independently or in conjunction with one another to automate the SBIRT process. And then once treatment is initiated, we progress to e-recovery, which is our solution that offers 24/7 support to individuals to help fill gaps in care and to alleviate the crises that provider staff manage. So if there's any interest in hearing more about e-prevention or e-intervention, don't hesitate to reach out to me. But what we will be speaking about today is the e-recovery solution. And then coinciding with the kind of twists and turns of the patient journey comes the provider journey. We work with hundreds of providers across the country, have a pretty thorough understanding of the market challenges that you face. Some are listed here. If you have other challenges you're facing, feel free to leave them in the chat. We'd love to hear from you. But what we're often finding is that providers are short-staffed, so the capacity to serve people has contracted. Access to care can be difficult with, kind of geographical restraints or things like, transportation being an obstacle. And that treatment adherence is of major concern. Every AMA discharge is not only a complication for the patient, but also a loss of revenue for the provider. And so we are aware that this list is not exhaustive, right? There's only so much we can include on one slide. We do know that these things have a major impact on the treatment that you provide and, the business that you run on a daily basis. And we are here to help. So briefly, who we are as a company. Chess Health is a digital health company with peers focused on addressing the substance use crisis and offering evidence-based solutions to combat it. So this little with peers here is very important because we're not just discussing an app today. We're discussing really an evidence-based solution that fully supports your patients and staff. And for context, we partner with a variety of different types of organizations. We have statewide implementations in West Virginia, Oklahoma, and New Mexico, and basically Ohio as well, where we work with hundreds of providers and community organizations like RCOs, reentry programs, et cetera. We partner with several MCOs and health plans, and then hundreds of other kind of independent providers across the country. And what these organizations are using is our e-recovery solution. So e-recovery, like I mentioned, is an evidence-based comprehensive solution to support individuals in treatment and or recovery from SUD. It includes a couple different components, our smartphone app, which we call Connections, our team of certified peers that are available to support you and your patients 24/7, a care management dashboard for your staff to use if they so choose, and even an optional rewards module to easily deliver contingency management if that is something that your organization is doing or looking to do. So we'll further explain what these items really entail. But before we do, I want to show you kind of some of the evidence behind the app and really give you the why up front. So many clinical trials have been able to demonstrate key metrics that directly align with your business goals. Use of the app correlates with a 40 to 50% reduction in key relapse risk factors and a 30 to 50% increase in abstinence rates. So really helping to improve those long-term outcomes, which all providers want to do. Use of the app increases treatment adherence, which was specifically proven by a statewide study showing that individuals using the app stayed in outpatient treatment on average 37 additional days. So really increasing revenue potential for you as providers. Outcome measurements often include kind of readmission rates or measuring, what those readmissions are. So we have proven that the app lends itself to a 24% decrease in readmissions to higher levels of care. So hospitals, detoxes, et cetera. And then lastly, studies show that the app leads to a pretty substantial cost of care savings. And while most of you are not likely paying claims for individuals, you may be offering some type of charity care or treatment grant, which e-recovery can help to alleviate. So we will expound on the app's functionality in just a moment, but I want to briefly explain one of the main purposes of the app. So this graph depicts a patient's kind of treatment journey. And if you zoom in, what we see here is that there are gaps in care, which can be up to 167 hours between appointments if the person is an outpatient. And we're often hearing from providers that they are worried when someone walks out the door. Will that patient be okay? Will they be back for their next appointment? Because, really it's inevitable that during those 167 hours, that patient will experience, some type of trigger moment, a craving, spirals of negative thinking, all of which can lead to a relapse or drop out of treatment. So the purpose of the e-recovery solution is to support individuals all hours of the day or night, all of those, 167 hours between appointments, to ensure that they return to their next provider visit with you, get another good dose of therapy, and then we will be there again when they walk out the door once more. So the functionality of the e-recovery solution was developed with very pointed intention, and that was to align with our recovery support strategy. And that strategy is twofold. So firstly, we help to address your business goals by extending your brand, serving as kind of an extension of your care team, so as to augment your efforts during off hours, and also provide ongoing connectivity, really alleviating the workload on your staff by supplementing your efforts. The second aspect of our solution strategy is patient-facing and consists of another 3 focus areas. 1, to reduce those relapse risk moments that individuals will inevitably face between appointments. 2, to strengthen and expand recovery coping skills. And then ultimately, when an individual cannot self-care through a specific event, our third focus is to offer one-to-one support to help ensure that that individual stays engaged in their recovery journey, stays engaged with you as their provider. So lots of background information, but now we'll jump into kind of the functionality of what happens within the app. So this is the home screen of the Connections app. A couple of things I'll point out quickly. You can customize this name at the top to reflect your business or program name, really extending your brand and connection to patients as we just discussed. This second portion here, patients can personalize for themselves. That can include their alias name to protect their anonymity within the app. They can track their recovery. They can participate in gamification and goal setting. They can even upload motivational pictures of their choosing, whether it be quotes or pictures of their loved ones. Mine's my dog. So whatever motivates them on a daily basis. Here they can engage in a daily check-in, which gives our team and you as their provider a bit of insight as to how the person is doing each day. And then they can also view and or post achievements here to celebrate recovery or life milestones, which we love. That's a rather new feature, and we love seeing people kind of celebrating their wins. And then one of the main features of the app is here what we call community. And these are discussion forums that individuals can access 24/7 and are fully moderated by our team of peers. So to expand on that just a little bit, computer's a little bit delayed and I apologize. We have 3 primary communities. So Connections Daily is really for kind of lighthearted, fun social topics with the goal of kind of fostering trust and openness within the community. Recovery Talk is those more heavy-hitting recovery-related topics, so coping skills, gratitude, that type of thing. And then Mind Matters is focused on mental health and wellness. We also offer population-specific communities like groups for pregnant and postpartum women. We do have a program for teens, if anyone is treating adolescents at their facility, veterans, and even peer support specialists that are working in the field. Our partners can also create their own private communities, which some choose to do and some do not, with the understanding that it is private to you and your patients and not moderated by our team. But I want to show you a quick example of what these communities look like, because I think the idea can be a little bit abstract. So this is a post from an individual going by the alias Tommy Salami. I did not make that up. That is really what his alias name is. He posted in the app that he was 104 days sober from alcohol and meth and was considering smoking weed to help take the edge off. So this is likely not a new story for any of us, right? We've all heard someone along the way express this type of idea. And so because our peers are moderating these discussion forums, the first thing that happens is our team responds. So Mary is one of our peers. She responds immediately by congratulating Tommy on 104 days and then asking him what coping strategies he used to get there. And then what follows is quite a large discussion. Actually, there were over 400 comments in this one. And it may be too small for you to read, but over here we have someone kind of sharing that they tried that method and that weed led them right back to meth. So really kind of sharing their experience, strength, and hope with Tommy and the group. And then I'll point out GAM really quickly because he does come up later. And GAM recommends that Tommy kind of replay the tapes, right? So Tommy posted in the app, received a significant amount of support from the community and from our peers. He got different kind of coping strategies, ideas to try. But there are thousands of other people that may not be posting, but they do get to read this exchange between other people and can still benefit from it. So I show you this example to really kind of reveal what communities look like, but to also make it clear that our peers are extremely involved in reading every single one of these messages. So this second kind of portion here, the middle section, includes a lot of customizable functionality to benefit both you and your patients. So I'll get into it, just a little bit of it. The rewards module makes the delivery of contingency management very easy and streamlined for providers, while also tracking the delivery of rewards to ensure compliance and reporting requirements are met. If anyone here is doing contingency management, you probably know that that's not always an easy process. And if CM is something that your organization is doing or planning to do, this is very much, it's an optional module. But if you've implemented the practice or are planning to, the rewards module will help to make CM something that is simple for your staff and will allow you to design your own program requirements and help to eliminate any human error to ensure you are within regulation. Our peers are also hosting different types of video support group meetings each day, really helping to overcome some of those market challenges that we discussed earlier, like transportation. Your team is certainly able to host your own group meetings if you would like to, but if not, just know that our team will offer that support each day. The content library is always really interesting for providers. It's really your place to post any type of information that you want to disseminate. So Chess curates kind of a library for you with things like TED Talks and meditations, but this is really where you can upload any program-specific information you want out there. So assignments, group schedules, local resource lists, videos, recordings of your group sessions. Anything you want people to have access to, you can upload here. And I always urge my partners to think big picture because you're really ensuring that patients have information at their fingertips, information of your choosing. There are evidence-based CBT modules included in this section as well. They come out of Yale University. They are in video form, so as to accommodate for any reading or education levels. They are fantastic CBT modules to help, learn and practice coping skills. I'm happy to send you additional information on these if you're interested in kind of seeing the evidence that's behind these as well. And then, the center section has a lot more, right? There's a place for individuals to journal or to plan their appointment or medication schedules. But for time's sake, I really want to jump down here to this bottom section of the home screen. And so this envelope here allows for you to message with patients, either one-on-one or in a group. If you choose to use the function, it is not a requirement. And then this lifesaver button down here is what we call the recovery help button. And this is something that an individual can press anytime, day or night, if they are really struggling and need support. It is pre-programmed to options of your choosing. So they can always connect with our peers, but maybe you have a 24/7 crisis line or something that you would like to include as an option as well. You simply let us know what resources you would like for the button to generate, and we will upload them. And there we go. So to show you really how the recovery button works, I want to circle back to GAM from our story earlier. And so this graph depicts the data that you as a provider would have access to for each of your patients. And while this might not mean much right now, I can tell you that what GAM is reporting on a daily basis is excellence in all aspects of his recovery. His treatment attendance is great. His meeting attendance is great. Spiritual practices, everything. GAM is doing well, right, in his recovery. And then all of a sudden, 6 months into his journey, he hits the recovery help button. He was given several options by his provider, but what he chose was to speak with one of our peers that evening. And so our supervisor on staff called GAM as he requested less than a minute after he hit the button, provided him some support to get him through the situation that he was in, and made sure that he was safe and okay before hanging up with him. We then followed up that interaction with a message to his care team, just a very brief note to let them know that GAM reached out for support. And as you can see down here, informing them that, after a quick conversation and a lot of compassion, GAM was, able to stay in recovery today. And actually right after that, which I love this, GAM took to the community forums to say that he used the button and thanked our staff for the rapid response. And just a quick update, because we really love to, see those that we work with flourish. GAM is still very active in the app today and has over 1 year in recovery. So I share this story to just make it very clear to you that our staff is really there to, support your efforts and alleviate some of the crises that you have to manage, while maintaining an open line of communication to ensure that you know exactly what is going on with your patients. And so what all of this information really shows is that it's really a combination of the functionality of the app, as well as our team of certified peers that are providing that safety net for you as the provider. Our peers are moderating those discussion forums 24/7. They are hosting those video support group meetings. They're providing that one-to-one support and alerting providers when needed. And so we have many providers that are using the e-recovery solution as simply an extension of their care team and an extension of their treatment offerings. But we also have providers that choose to utilize the CHEST dashboard. And the CHEST dashboard is where you are able to view all of your patient information, what your caseload is doing in the app. You can send out appointment and medication reminders to help decrease those no-show rates. But it's also where you can go to do things like deliver telehealth or recovery coaching to your caseload. You can host your own group meetings if you would like, or message with your patients kind of in a HIPAA compliant way. And you can also use the dashboard to collect and assess a significant amount of data. So the Connections app includes two things: a daily check-in and a weekly BAM survey, the Brief Addiction Monitor survey, which you have access to. But it also supports custom assessments. So if you're looking to collect specific outcomes data, you just give us a copy of it, and we will upload it into the system for you. But all of that data can then be exported into identified or de-identified reports. So what this graph is showing is actually one patient's journey. Looks fairly standard with both highs and lows. But what our team is keeping an eye on are these low points. So when someone reports, recent substance use, or they report that they're not confident in their recovery that day, our team will automatically reach out to provide that one-to-one support we spoke about earlier. Your team will then be notified, as you can see by the quote from Jenny's case manager, kind of letting us know that he's grateful for the communication. Patients also love, that kind of safety net. This was actually a message from Jenny referring to us as her family, which is fantastic. But alternatively, if your team chooses to, you can also access all of this information to help guide you during your treatment sessions. So if you're meeting with someone and you see that it's been reported that they've been struggling to sleep for the past couple of weeks, it can help you to either address it or adjust their meds if needed. It really gives you a lot of insight that you may not otherwise have, while being confident that your patients are supported during those difficult moments in their recovery. And then before I pass to our wonderful partners, I want to quickly go over the enrollment and onboarding process. So in the spirit of alleviating the workload on provider staff, we have made enrollment very simple. So we offer 3 different methods of which to choose from. The easiest way, and what we really consider to be kind of best practice, is to ask one of our peers to do it for you. You can invite us to virtually attend, say, a Tuesday night IOP, for example. We'll hop on, get each person into the, in the group fully onboarded for you, just making it very easy on your staff. If that is not an option, you can use this quick enrollment link, which is a form that requires 6 data fields. It's like name, gender, date of birth, phone number. It automatically sends a link to the individual's phone to download the app. And then lastly, if you're simply sitting in your office with someone, kind of meeting with them, you can use the CHESS dashboard to create a new patient profile and set them up from there. So just as our team is there to support your patients at any time, we are certainly equally dedicated to making the onboarding process easy on your staff to really ensure successful adoption. So for now, I think we've heard enough from me. I would like to pass things off to Alex to discuss his experience with using e-recovery within his organization, and then we will hear from Jill after that. So Alex, just let me know when you want me to move slides.
Sounds good. Thank you, Catherine. So just a recap. So Alex Figueroa, we're with United Council Citizens of Bennington County. We are a designated mental health agency and a preferred provider, which means we just provide substance use services. We're located in Bennington. That's a southern Vermont. So you can see the arrow. So we service that whole area in green. And so we provide a variety of different services, from outpatient counseling to we have a really robust intensive outpatient program. We just launched in April a MAT program. We just developed a new outreach program specific for SUD. So we have a variety of supports that we provide here down in southern Vermont. Just some things I really wanted to kind of comment on. The reason why we went with CHESS Health, and I first want to just comment and highlight the team. They, since day one, they've been just truly an amazing partner. We started this process about 2 years ago. We had met a few representatives at the national conference back in DC, and and instantly, it caught our attention, and it took us about a year to officially sign the contract. So it's been great. In terms of funding, primarily the folks that we service are Medicaid. We do have some commercial insurance that we support, but the bulk of our clientele is Medicaid. In terms of the reason why we went with the application was the idea of, let's get as many tools and resources in the hands of folks as possible, right? We know, especially living in a rural community, there are many challenges: transportation issues, access to care. We only have 2 inpatient centers in the state of Vermont. One is located in Chittenden County, which is, if you look up north, just outside Burlington. There's one, and then we have another one that's in Rutland, which is right above Bennington. But that's 2.5 hours away to get to Burlington, and then it's about an hour. But when you think of wait times, I mean, you're thinking, anywhere between 1 week to 1 to 2 weeks to get folks into inpatient settings. So because of that, because of the increase in need, I mean, Bennington County or Southern Vermont has one of the highest overdose rates per capita in the state of Vermont. And that fluctuates, I think every year, but we have been top 2 or even top 3 the last 5 to 6 years. And so just some other data, we actually have the highest ED utilization rates in the state of Vermont. That's right next door. Our hospital is right across the street from us. And so, we were just thinking, what can we do just to support our community and support our folks? And so in January of this year, so it's only been about 10 months, we implemented the eRecovery Connections app. And you can go to the next slide, Catherine. And we've had great success. We have currently around 50 people enrolled, 36 that are actively participating, right? That means that, they're in the app, they're participating in the survey, they're really engaged. And it's been just an amazing experience. When we integrated, it really helped kind of fill the gap in a few ways. One, in terms of recovery support, we do in the state of Vermont, we have part of the system of care. We have kind of 4 different levels, right? We have partners that focus on treatment. We have partners that focus on prevention. We have partners that focus on intervention, but then we do have partners that focus on strictly recovery. And in the state of Vermont, it's called Recovery Vermont. And so each county has a peer recovery center. And but even with that, staffing is a huge barrier. And we wanted to integrate this because Catherine had highlighted the recovery help button. That was the one thing I think that stood out to us the most, is that just immediate access. And we think about hours that we can't provide services, right? I think the weekends, it's a Friday night at 2 o'clock in the morning where we don't have the staff to respond. And we do have an emergency services team, but our emergency services team encompasses the whole county. And so, that's an hour at any which direction, right? Because we're very rural. So we could not respond. And that was the one area that it stood out to us. And I'll give one example. We actually had one individual that when we launched the application in January, within I think a 5-week span, she had utilized the recovery help button 57 times. And so I assure that, think about that, at least from our perspective, 57 times that we wouldn't be able to respond. And this is during the off hours that, the agency wasn't opened. This person had bad experiences with inpatient, so she didn't want to go into an inpatient setting. And so being able to respond immediately, right? So they click on the recovery help button, and within a minute, whether, text, email, call. And what was amazing, and this is just, I can give you 1 or 4 examples. This particular, the peer engagement specialist really became part of our care team, right? So we would, as Catherine mentioned, we would get the notifications from the engagement specialist. And then when we're back in the office, we're able then to follow up with the client. And we actually had a care team meeting with the peer engagement specialist to just kind of talk about progress and just things that her treatment plan and what's been working on within her outpatient services, and we actually learned some things from the peer engagement specialist that we didn't know prior. So it was like really they were able to really develop a relationship that I don't think we could have developed, and so we were able to really share that, and we learned more about the client in certain aspects. So that was really amazing. And the success with this particular client, engaged with, is fully engaged in services now. In our IOP program, in our MAT program. She's with us, about 15 hours a week, and she's a role model and she's a leader now. People within the program are looking up to her. And she's it's a testimony. Again, that's one small example. I shouldn't say small one. Amazing example of the benefits of what Chest Health has done for our program. And honestly, I think it goes back to, it saved her life, to be honest. If you knew this individual story, it really saved her life. And that's what we're in the business, again, providing tools in our folks' hands and as many resources as possible. And it saved her life too. So in terms of next steps, it hasn't been a full year yet. So we're still working to increase engagement. We are looking actually next week, I should say, 2 weeks, November 12th. We're going to be expanding the eRecovery Connections app. So we're going to be, there is a teen function. It's called Teen Scene. And so we'll be implementing that portion into our youth and family services division, which is really exciting. So that's going to be really phase 2. So we'll be doing that in a couple of weeks. So that's going to be really exciting. In terms of funding, we were able to pay for this. We had one-time fundings from last year. Going into year 2, we have a 3-year contract. We're actually, it's going to be paid for just based on current programming. So we'll just use funds to pay for the cost. So we do have enough money to be able to do that. And our end goal, we are a pioneer in the state of Vermont. We are the only agency in the state of Vermont that is utilizing this application. I will say I attended a conference 2 weeks ago, actually a peer recovery conference, and this has generated a lot of interest. And so over the course of the next few weeks and months, we'll be doing, of course, in partnership with Chest Health, some presentations on, because other providers are interested in this application. So that's next for us. So I think that's it for me. So I can kick it over to Jill, or if anybody's has any questions, feel free to ask.
Thanks, Alex. Does anyone have any questions for Alex, or maybe Jill can share her story and then we can circle back to questions? Might be the easiest way. Yeah, let's.
Perfect.
There we go, Jill.
Okay. Thanks for sharing all that information, Alex. I certainly many of the things that you said resonate with myself and people in our organization too. So that's awesome to hear. So Arbor Place, as I mentioned in the beginning, we're located in Wisconsin. The 2 counties that are highlighted on the map are Dunn County and Pierce County. That's where our locations are. So in Pierce County, we have a branch office that offers outpatient services. And then in Dunn County, that's our main facility. So we have residential treatment for adult men and women, as well as outpatient services for teens and older. And we also have a prevention department that does a lot of community-based work. You can see there on the slide an overview of our demographic information in terms of these 2 counties. We are mainly rural. And what I will say is, in terms of our population that we serve, outpatient obviously is very location specific. Most of our clients do come from these 2 counties and directly adjacent counties. But our residential program, we draw from the whole western region of Wisconsin. We have more than 2 residential facilities. So Alex, I was like, oh my gosh, you only have 2 residential facilities. But with that said, there's certainly not enough residential treatment in Wisconsin. And I'm sure with your locations too in New Jersey, there's always more need than there are resources. For our funding for our organization as a whole, we do have a pretty good payer mix. We are a fee for service and direct pay. So some clients self-pay for their services, fee for service. We can bill commercial health insurance, as well as we have a large percentage of our clients, much like Alex referenced his clients, that have Medicaid for their health insurance. We also have county and state funding contracts and a variety of grant funds that help to support our services. You can go to the next slide. Specific to funding the Connections app for us, what I will say is that we actually have a SOAR grant. So our state has disseminated some of the SOAR, the State Opiate Response Grant dollars down to the local levels. And so we have a contract with our local county in order to implement treatment and recovery support services. And so we do use some of those grant dollars to help support funding the Connections app. And then we've also been able to obtain some additional grant funding to support the app also. Our target population for SOAR is opiate and methamphetamine, but it's important that we open up this application to all of our clients. So that's why we have a mixed funding base to support the Connections app. Needs to be addressed. Obviously, there are gaps in recovery support. Arbor Place as an organization, we do not have any peer specialists on staff. We do have some other organizations in our community and in our region that are able to provide peer support services. But up until now, we have not been able to employ our own. And so certainly having immediate access to peer specialists through the Connections app is really valuable for us and for our clients. The competitive differentiation is important. Much like many of you, I'm sure we could continue to operate as we are, right? Again, there's more need than there are services. Our appointment slots are filled. However, it's really important to me as the leader in our organization that I do look at ways that we can continue to improve our services in order to benefit our clients. And part of that is looking at how can we do things differently. Certainly COVID opened up our eyes to a lot of different things that are technology based that can support our clients. And so in thinking about how often our clients and ourselves utilize technology and scroll on our phones on Facebook or different social media, this application really resonated to us as something to offer to our clients. For our residential clients, prior to their discharge, we offer them the opportunity to be onboarded onto the app. So we have not yet integrated it into our residential treatment framework. I'm hoping to do that in the future, but we haven't quite gotten there. Access to technology while they're in residential treatment for some can be a little bit of a slippery slope. So we're just trying to navigate the best way to do that. But it is important and it is part of our processes that we onboard them prior to their discharge. So again, going back to thinking about who we serve people throughout the region. So after they discharge from residential from us, they may go to another outpatient provider that doesn't offer this, but they can still utilize it even though they aren't currently a client with us. In outpatient, we offer our clients the opportunity to onboard at the very beginning of their treatment with us. What I have found is that the best way to promote the use of the app is by having other clients talk about it. So the more we have our clients use it, if they're in groups together and it is brought up as a topic or somehow in the group discussion it's brought up, there's several clients that have said or may say in the future, this is a really great app. Are you guys using it? And so we know that peers are really influential and impactful on all of our clients. So this is another method or a mode in order to give them to interact with other people. I do have a bullet item here that says meet federal regulations. And so for me, in running the organization, I have to make sure that we're meeting our regulations and guidelines that are put forth specifically by the block grants. So the substance abuse block grant dollars that we get, and thinking about those interim services, if somebody has to be put on a wait list, as well as some of our state regulations, you know, having a after hours number and so forth. And of course, we do have a phone number that our clients can call. But again, what has been shared earlier today is, boy, how much easier it is for many of our clients to hit that help button, and also how much more comfortable it is for many of our clients. So certainly think about those things. What are things that we're obligated to do and regulated to do, and how might this app actually help us meet those regulations? So we launched the Connections app in March of 2022. So we've been using it for about a year and a half. We do have 406 individuals that are they active in the Connections app? Oh my gosh, I love those numbers. I'm such a numbers person. I love those numbers. The little screenshot up on the right corner of this slide, I love that you put this in here too, because this was just posted recently anyway. Yesterday. Okay, awesome. Yeah. So this client, it looks like, was onboarded onto the app September 13th. And Java Joe posted, I have no idea about levels. Obviously up there it says I reached a level 7. I have no idea about levels or how I got here. With that said, I'm grateful for this group and the app. Still finding much good support in my journey. You all are great. That is fantastic. That means that this app and the support and the resources that Java Joe has found on it or with it has been very valuable to him. And I don't know if this is a client, you know, that may be in a different area of the state, or a client that's in our outpatient. I'm not really sure. But what I know is that Java Joe has expressed that it's been helpful for him on his journey. So that's fantastic. We do use the contingency management platform. And what I'll say about that is that tracking for contingency management can be tricky. And so if any of you are already doing contingency management, you know that federal dollars have a specific limit. You know that it's really important to track how many rewards and the amount of rewards that are given. And while we could do this on a spreadsheet, I also know that that opens it up for human error of inaccurate tracking. And I also know that it's difficult to track once our clients maybe start a different group or start a different program. And also, I'm the person that our staff come to when they're like, hey, can you order more gift cards for me? And then I forget, and then we don't have the gift cards. And so that certainly has made the implementation of our contingency management approach a little bit easier, because it's based on a refillable credit card. So it certainly has made administration of the contingency management a bit easier for us. And I can certainly talk more about that if people have questions. The last thing that I'll say is really what's right there in the quotes, is that this app for us has been shown to be really ideal for filling the gaps in recovery support. And those are gaps that we would not be able to fill as an agency who is already struggling with the amount of work that our staff are tasked with, at times being short-staffed, and always trying to do the right thing for our clients. And this app has really helped us to be able to do that in a way that we had not previously been able to do. So with that, I will close my part of the presentation and certainly open it up for questions, or if there's additional things you want to go on to, Catherine.
Yeah, thank you, Jill and Alex, for sharing your experience with e-recovery and chest health as a whole. Does anyone have, we're kind of coming up on the hour, so does anyone have any questions or comments for myself, Alex, or Jill?
Yeah.
Hi. Go ahead.
Sorry, go ahead.
No, go ahead.
Okay. I'm Anthony. I work at Prevention is Key in New Jersey, and my question is, how do you integrate this app in any of your outcomes assessments? like the data that's collected via the like daily check-ins?
Mm.
Do we
Um,
integrate with the outcomes? Oh, go ahead, Jill.
I was just gonna say, I can share what we do. So I remember in one of Chess Health's early presentations to us about using the app, the statement of you can do as much or as little with it as you want. And I have tried to take the approach of doing as much as we can with it. So at this point, I do routinely encourage and remind our clinicians that there may be some really helpful information about their client on the app. So looking at, has your client responded to the daily questionnaire? How confident are you in your recovery today? Or have they responded to the weekly questionnaire, the brief addiction monitoring survey, which asks many more than one question? And then it's up to our clinician to look at that information in order to perhaps better address the individual session. So on an individual level, that's how that information is useful. On the kind of macro level, we do gather the information. I have one staff person that's responsible really for routine presentations to all my clinicians to say, hey, this is what our clients that are using the app, how they responded to those daily or weekly questions. So we certainly feed that information back to our clinicians. One, in order to encourage them to utilize the dashboard to get more information about their clients, but two, also, again, to get a little bit more of that macro picture of our clients. Beyond that, measuring outcome data, as we all know, can be really challenging. However, the information that you get from the Chess app can certainly feed into, annual reports or outcome studies, as long as we know kind of what the limitations are to it. It definitely is another way to get some data points on our clients.
Thank you.
Yeah, and for us, and to Jill's point, I mean, there's a lot you can do, and what's nice, whoever because I believe each kind of territory has like a regional director, and so my point person, I would actually we set up a meeting like, hey, can we go over outcomes specific for Chess Health, and keeping in mind you'll have access to the dashboard. And so we do it can be also individualized. So if there's certain clients that we know that maybe have high utilization, or if someone's been utilizing the recovery help button a little more frequently, we'll pull that out and we'll have a kind of a care team meeting. But in terms of overall data and outcomes, we look at all of it. So for me, every quarter, we're looking at initiation engagement rates, we're looking at length of stay. There's a list of things that we look at, and then now we've added this to the conversation. So when we're looking at all of our data, we also get to see the engagement in terms of this support, the engagement and whatnot. So yeah, it's an addition, if not anything. And I do believe this has helped improve our outcomes and our engagement within our programming.
Thanks.
And I'll just add really quickly, Anthony, just from like a Chess Health standpoint,
Yeah.
it really depends on like the customer and what they want to do with it. We have some customers that are basically running their own kind of trials where they are, they have an alumni group that get the app, they have an alumni group that don't get the app, and then they're measuring those long-term outcomes, that kind of thing. And then we have other providers that say, we just really want to kind of fill those gaps and allow people to access that support kind of on an ongoing basis, and that data collection is, of less importance. So it's really up to you and your organization in terms of how you would like to use it. But certainly if data collection is important, we can absolutely, kind of supplement those efforts.
Thanks.
Yeah. Was there another question?
Yes, hi, I'm Audrey Carter from Division of Mental Health and Addiction Services, the Office of Treatment and Recovery Supports. Just wanted to ask, how do you, I know you do different types of onboarding, where people can onboard on their own or have Chess Health on board for them. How do you talk to them about confidentiality, and do they sign releases that is shared with different, how does that talk to the client, not the client, but the person about when you're discussing onboarding with them, and that this data may be used for different things.
Yeah, so there's certainly a consent that they need to agree to when they sign up for the app. But in terms of kind of a conversation prior to that, Jill or Alex, do you want to speak to how you approach it?
Yeah, I mean, yeah, I think transparency is always best, right? And we're very transparent. I will show kind of a sample what the dashboard will look like. And I will say there's times where some clients are hesitant because of that, because it is private, and team leads or folks that have access to the dashboard, they're the only ones that are looking at it. But 9 times out of 10, most folks are like, that doesn't really bother them. But we do share that up front, and it's very rare that there's concerns. But when we do have those, that is when we actually would, and I have to do a better job at this. This is where we actually utilize Chest Health, because they, a lot of times, they want to connect here personally from a peer engagement specialist, and you tend to have better outcomes when a client's talking directly to somebody that is on the other side of it. So, usually at that point, you get really good results.
The one comment that I'll make is, in thinking about the processes that each organization may want to set up, that's certainly something or an area that is important to take into consideration. And I know that I could certainly, put up a QR code or a poster with a code saying, hey, download this app. But then that reduces the interaction and ability to have some of that information shared and transparency up front. Within our processes, as often as we can, we have one of our recovery coordinators actually sit down with each client and talk through what the app is, and as well as confidentiality of the information in it, and walk them through the onboarding process. So it's a little bit more hands-on.
And Audrey, if we want to get really complex, we can actually turn off your ability to see it. We work with some reentry programs that don't want to see it because they don't want their patients to kind of fear that. So there's certainly, the good thing about offering a lot is that we offer a lot. The bad thing is it's hard to talk about all of it within an hour, but I know we've kind of come up on time. I want to thank everyone for connecting today. It's certainly, been a pleasure. Huge thank you to both Alex and Jill for taking time out of their busy schedules to share their experiences with the group. We really appreciate your time and effort. If you are interested in kind of hearing more or chatting about, what this could look like for, your organization specifically, certainly, drop your information in the chat. I can reach out via email directly, or because we're a technology company, you can scan this QR code here. It will take you directly to my calendar if you just want to, book some time to kind of chat about, specifically what this could look like for you. So. Also, huge thank you to June and NJAMHAA.
Yeah, I just wanted to add, that we didn't talk about it, but there is the Discovers money. It's a $20,000 pool of money that would more than, I don't know what your pricing is, but I know that would be more than enough to get themselves involved with Chest Health.
Right.
So if you're a contracted agency, which everybody on this call should be, because it was by invite only. So there is a pool of money available. Suzanne Boris is on the call. I don't want to put her on the spot, but if she'd like to say something about it, she's welcome to join the call, the meeting at this time. But yes, I wanted to thank you. And I also just wanted to put out one little piece of information, that this is not a new application. It is just one that is consistently improved over the years. I had Dr. Gustafson out back in 2013 present at the IT conference on the initial application, which was known as HS, I believe. And it was one of the first applications out there to address the recovery field. We're very proud to see that this application has developed over the years. True outcomes and improved lives are a result of it. So thank you all to those at CHEST. Thank you to our guest speakers today, to Alex and to Jill. We really appreciate you being here. And as Catherine said, you can scan the QR code or just If you need any information, you can come to me. I will be posting this recording on our YouTube channel. So thank you very much, everyone, for joining. And Suzanne, did you want to say something? I see you on screen. You unmuted.
Yeah, I just was gonna, remind people that we do have this pool of money called Discovers that's used to enhance technology at agencies to support client care. And that's something to take advantage of if your agency hasn't already used up its allocation.
Great. Thank you very much. Thank you to Chess. Thank you, Suzanne. Thank you to DMHAS for all of your support. We appreciate it. Take care,
And
everyone.
thank you, June, for hosting this. Okay,
You're very
bye.
welcome.
Yeah,
Thank
thank
you.
you.